Uh, Good morning, ladies and gentlemen. My name is Edgar Marumbu, for those who might not be familiar with me. This morning, I am joined by our public health officer, uh, Alex Ontiri, who will be able to take us through today's session. Might I begin by saying, yes, this session is being recorded on Zoom, and for access of those who are not going to be with us in this Zoom room. As it is being recorded, it is also being streamed live on YouTube so that other guys can follow us, our students. I know some people, it's easy to get YouTube bundles than getting bundles for Zoom. So we are providing multiple platforms for us to follow. Let me begin by saying that this training is very important and critical for our reopening, because as you come back to the university, you were here quite a few months ago. As you come back to the university, you realize that quite a number of things has changed. How we operate, how we even accommodate clients in our offices, how we walk around. We no longer just walk around without masks. We sanitize every other time in the university. More often than not, you will be checked your temperature a number of times. So quite a number of things has changed in the university. And as that happens, we need to let you know that when you come back to the university, as you're planning to come back, because I know most of you have already seen the calendar that is supposed to guide us in the course of this semester, in the course of the staggered reopening. As you plan to come back, we need to make sure that you are in good books and that you are at a point where you can be able to, get there in terms of learning and being protected at the same time. We don't want you to catch COVID-19 at the expense of you doing your studies. So that's why we're here. So this morning, let me introduce straight away so that we begin this session, Bwana Alex Ontiri, who is our public health officer in the university, responsible for enforcing all the COVID-19 guidelines as cascaded by the ministry. He is the man who will be able to assist us, make sure that we keep you safe while you are on campus. Ladies and gentlemen, put your hands together, digitally speaking. Of course, these days we clap digitally only. For Bwana Alex. Alex, karibu sana, and talk to our students.
Thank you so much, Edgar, for the introduction. Can you hear me? Edgar, can
Yes,
you hear me? Yes,
yes,
thank
we
you
can
so
hear you,
much.
Alex, very well.
So can I share my screen?
Yes, before
Or
you do that, maybe I just ask for you to adjust your laptop a little bit so that you're centered. Yes, fantastic.
all right.
Now you can share your screen and then commence the presentation.
All right. Thank you so much, Edgar, for the powerful introduction. All right. Thank you so much. My name is Alex Ontiri, and I would like to take this opportunity to welcome all the students and everybody listening on YouTube, via Zoom, to this important, very, very vital session in this COVID-19 pandemic period. And I would like to take you through a few of what we put in place, some basic highlights that as you come to the institution, as you plan to join in the institution again, you'll be able to actually, we want to keep you safe. That is the work of public health and the medical services department. So this training, these are small sensitization, you take very few minutes. Actually, it's a step-by-step guide, and then later on, you're going to give you a platform for asking questions, and then you'll be able to respond to them together with Dr. Nyanga, who's the medical officer for the institution. Thank you so much. As you've been told by Edgar, my name is Alex Ontiri. I'm the public health officer for the institution. And these are very brief sharing, and it's going to be an interactive session so that you can be able to know how to protect ourselves in the institution as we come in and as we stay in the institution once we resume. So we're going to learn some of the standard operating procedures already put in place by the institution, some of the protocols already put in the institution, some of the COVID-19 protection measures that have already been put in by the institution, in place by the institution, and some of the things that you'll be able to encounter as you come in for the in-person learning. So I don't know if you can see the presentation.
Yes, we can see it, Doc.
All right, thank you so much. So the outline is as follows. So we're going to look at the overview of COVID-19. Generally, I'm just going to give you a preview of COVID-19. I believe you already know this. Since March, you've been informed on this. And we're going to look at how is Kisii University prepared in terms of COVID-19 prevention, and also medication. We're going to look at some of the regimen you've already put in place for COVID-19. We're going to look at protocols and standard operating procedures. already put in place, and what is your role as a student in terms of preventing or combating COVID-19? Because this is an invisible enemy that all of us must be involved in order to protect and prevent the spread of the virus. So basically, these are the outline. So as you already know, I'll just give you a small hint on COVID-19. So COVID-19 is called, the virus is called SARS-CoV-2. That is severe acute respiratory syndrome, COVID virus 2. There was SARS-CoV-1 that happened earlier on in early 2000s. So coronavirus is a large family of viruses that is known to cause illnesses ranging from mild to severe illnesses, like common cold is a mild form of the virus, to severe form of the virus or disease like MERS or SARS, that is Middle East, that happened in the Middle East, and severe acute respiratory syndrome. Now, in human beings, this virus can cause mild diseases such as common cold that we've already said, and it is said to be zoonotic. A zoonotic disease, a disease that is transmitted from an animal to man. So that's what we call a zoonotic disease. Now, this is very important. People with COVID-19 may develop a wide and a broad range of symptoms, and we've already seen that from the patients we've encountered in our medical center. And these symptoms may range from mild to severe forms of the symptoms, which lead to mild to severe forms of the disease. And the symptoms may develop from the 2nd to the 14th day after exposure to the virus. And we're going to see in the next slide how we expose to the virus and what are the possible ways you may be exposed to the virus if you come to the institution without adhering to the protocols you've already put in place. Now, we've listed some of the symptoms, which if you experience them, you need to report urgently to the medical services department if you're around the institution, or to the nearest health facility if you're not around the institution, because we have a medical center at the institution. And these are the symptoms. Number one, fever or chills. So you might experience fever that is elevated above normal, that is around 37.5 and above. So if you experience that type of fever, by one, you'll be checked at the entrance. You're going to see at the entry guidelines. Before you enter the institution, you're going to be checked your temperature. Or you might also experience chills. Okay, something else you might experience is cough, a dry cough. Okay, sometimes it can be productive cough. Again, something you've noticed from the patients we've encountered of COVID-19 is congested or runny nose. A congested or running nose is it's a symptom that you need to report. It is similar to what you call common cold, homa kawaida, but you need to be aware of that. So another symptom that you need to be aware of as you come into the institution is if you experience shortness of breath or difficulty in breathing, immediately report to the medical officer or to the public health officer or the toll-free number which is being developed, and you'll get it soon. Another symptom you need to be aware of and watch is fatigue, general body or muscle aches. If you experience headache, or if you experience a new loss of taste or smell, sore throat, or nausea and vomiting, or even diarrhea. If you experience any of these things, they might not be the full package as we've listed. It can be fever, cough, and headache. You need to report to the medical center immediately. You call in ahead, put on your mask, and you're going to use some of these guidelines going forward. So these are some of the symptoms that you need to be aware of: fever, fatigue, headache, sore throat, all these things. And majorly, if you look at these things, they affect the respiratory system. So anything that you feel that is affecting respiratory system, then you need to report it urgently. Now, how can you get COVID-19? COVID-19 is transmitted in three major ways. Number one, it is transmitted through air via droplets of cough or sneeze. So if someone, your friend, coughs or sneezes, and the particles or droplets are transmitted via air, then you breathe them in, or they touch your eyes or any part of your skin, and then you breathe them in, you're going to get COVID-19. Or number two, COVID-19 is transmitted through the second major way, through close personal contact. That is either touching, kissing, or shaking hands. So these are some of the ways that we experience through human beings. The third way that COVID-19 is transmitted is through non-living, what we call fomites in medical term. That is when you touch a contaminated object. What are some of the contaminated objects that you might be exposed to? Number one, It can be your phone, you're sharing your phone, maybe you're trying to call or you're trying to Zoom, you're trying to attend a lecture through maybe you're with your friend. It can be your car keys, it can be the doorknob to your room in the hostel, it can be a pen, it can be anything, a book that you're sharing. So these are some of the things that, some of the ways which COVID-19 is transmitted. Once you touch a contaminated object and then you touch either your eyes, nose, or mouth, you might get COVID-19. So why are we saying this? This is important so that you know how to protect ourselves. When you know how it's transmitted, then you can break the chain of transmission. All right. So, what are some of the ways Kisii University is prepared in terms of COVID-19? Since March, the Medical Services Department, together under the instruction of the management, we've been up and running. We've been trying to do our best, and indeed, so far we've done a lot that we are ensuring to ensure that once you come in, either staff or student or any visitor, you are protected from COVID-19. And we've done our part. This is what we are going to say, the part we've done. And the remaining part is up to every person entering the institution, student, staff, or visitor, to ensure that you are there to what you put in place. You protect yourself, you protect the institution, you protect the community, you protect everybody around you. Okay? So before entry guidelines, what have you put in place? So we've done this to ensure that before you enter, you must put on your mask. That's why if you see the invitation from the Registrar Academic and Student Affairs, you need to come with a pair or 5 pieces of washable masks. We are going to show you how to wash masks. So, number 2, before you enter the institution, ensure that it is a must for you to be checked your temperature at the gate, either on the forehead or on the ear. There are many people coming with theories of checking the temperature at the hand. That is not the
Uh,
recommended place.
Doc,
Yes.
Doc, Doc, sorry to cut you short a little bit. I can see you have shared your screen, but there is nothing showing. I don't know if there's something on the slide right now. Yes, now it's good. Now it's good.
Which slide am I? Before entry?
You are on KSU preparedness on COVID-19, before entry guidelines, after entry guidelines, contact register, and contact tracking. This is what is
Okay.
showing on the screen.
All right.
Okay.
So there we are. So
Sorry.
sorry. Thank you, Edgar, for that. So we are looking at before entry guidelines. And what you're learning is before you enter, number 1, put on your mask. And the mask is put on properly to cover 3 parts. Number 1, the nose, the mouth, and the chin. Ensure that you put on your mask properly before you enter the institution. And before you enter the institution, it is mandatory for you to be checked temperature at the entry points. We have 2 major entry points within the institution, a barricade and the main gate. So as you enter in the institution, you must be checked your temperature. And that is the protocol that we have at the moment. Again, number 2 is after entry guidelines. Before you, after being allowed by the human resource at the main entrance, you'll be allowed to enter the institution. After you enter the institution, you'll be asked to do the following things. So after you enter the institution, you'll be allowed to do the following things. Number 1, we'll ask you to ensure that you put on your mask properly as you enter the institution. And then we'll ask you to ensure that you adhere to social distancing. That is a distance of between 1.5 to 2 meters all around, either towards the front, the sides, and the back. Ensure that the social distance of 1.5 to 2 meters in all directions. And then we put hand washing points at the entrance. So ensure that you wash your hands after you've been allowed to enter in. The institution has produced enough soap and we have enough sanitizer for the students. So we are ready to ensure that you are protected. And we're going to show you how to wash your hands through some of the posters you'll find at the entrance, and in the social media, you'll find these posters on how to hand wash and how to sanitize your hands. Again, we'll ask you to regularly disinfect any commonly shared places, be it a lecture room where you sit. Don't wait for a cleaner to come because they might not actually do 100%. Before you sit down and you know someone has been there, you can do some sanitizing. You can use some sanitizer and clean the place before you sit. In case you're sharing a phone, then sanitize your hands before you hold it. After you leave it again, sanitize your hands to ensure that you are safe. Something else after you enter the institution will ask you is to ensure that you leave the institution clean. Don't throw your mask anywhere. So we'll ask you to bring your mask to the medical center, which is located in main campus. So we have, that is the designated point at the moment. However, we are going in the process of procuring waste disposal bins, so you can throw your mask if you feel it's no longer fit for using. Now, in case we have someone with the COVID-19, then we'll ask the student or staff before they enter to ensure that they isolate themselves. If you experience any of the symptoms that we shared earlier, ensure that you isolate yourself and keep yourself away from the institution. And then you need to call in the medical center and say, I'm experiencing the following things. Okay, and immediately you need to put on your mask and ensure the people around you have their masks on. So, and if you're a suspected case, that is, you experience any of the symptoms before being confirmed by a laboratory test, then we'll ask you to actually don't share household items with your people, don't visit public places, don't use public means of transport, and you separate yourself from people, and then you avoid going to shared places like supermarkets, to maybe clubbing places, to social events. Avoid those things if you're a suspected case of COVID-19. And then finally, if you're a suspected case, before you enter, we'll ask you to monitor the symptoms. If you are experiencing cough and a fever, then we'll ask you to monitor development of these symptoms. We have a link with Cambry. We'll send you there for testing. Okay, so that is some of the protocols we've already put in place. I'd like to go quickly to contact tracing. Now, contact tracing is very, very important. A contact is defined as any person who has had a close contact with a confirmed case and is not yet already confirmed in the laboratory if the virus SARS-CoV-2 is present or not. So if you've been in contact with a person who is already a confirmed case of COVID-19, you are a contact. We call you a contact. So we'll ask you to not to visit the classroom or any other place within the institution if you are a contact. Now, the institution has developed a COVID-19 contact register that is available in all offices where you will visit. This one says that you need to actually sign in your name, the date you entered into the institution, into that particular office, where do you come from, all the social demographic information, sex, registration number, and then you sign. So this is important. The COVID-19 contact register that is in main campus and other campuses, all offices, is to ensure that we only track the people who had interacted with the confirmed case, so that you don't take the whole class for testing, yet only 2 people interacted with the confirmed case. So that is all about COVID-19 register and contact tracing. The medical services department is very active. The surveillance team is very active, so we'll be able to track every person, and we want you to be very proactive. Report to us if you see someone who's experiencing the symptoms. It might not be you yourself. So ensure that you report to us if your roommate is experiencing this, then call us and then we'll come and do the necessary procedures. I've already talked about hand washing. We already have enough hand washing points. We have hand washing tanks, sinks, hand washing soap already in place in the institution, and we like you to actually take this up. Protect yourself, protect your friends, protect your classmates, and protect even your family by washing your hands within main campus. So there's a step-by-step procedure you'll find in the institution on how to hand wash that is already approved by the World Health Organization. We usually say that washing your hands anyhow is not secure enough to protect us from COVID-19. That's why we have a standard way of ensuring that our hands are washed. If we don't wash our hands properly, then we'll be having a false sense of security that our hands are safe. Same case to hand sanitizing. We already have more than 4,000 liters of sanitizer. I don't know how long that will take even 1 year for it to be depleted. So we have a protocol for hand sanitizing. You'll find the hand sanitizer in most of the offices, and hand washing, you have more than one. At the moment, you have 200 liters of liquid hand wash, and you're going to produce more up to 1,000. I'll talk about masks. I've already mentioned it before. So we'll ask, it is mandatory for you to, when you come into the institution, you'll be asked to actually bring 5 masks with you. And we've already put in place, I believe everybody now knows how to wear a mask. So ensure that you've done your mask properly. That is, donning is putting on. you put on your mask properly and ensure the mask is fitting. Number one, check for any irregularities or deformities in the mask. Don't wear a mask which is torn or a mask which is old. Ensure that the mask you put on is it's fitting, and it doesn't give you a hard time to breathe. And then when removing it, ensure that you remove it properly and dispose it. If you want to dispose it at the designated points. If you want to wash,
Doc,
yes.
just an interjection. I don't know if you have a mask close to you. You can maybe show it
Oh,
how you
sure.
can don, and yes.
All right. Thank you, Edgar. Thank you for the practicals. I also have a sanitizer with me. I'll show you how to do that. So this is a step-by-step way. A mask with the mask you're producing in the institution. I'll show you one. So this is a bundle of the masks that you have in the institution. They are washable masks. And I'll just take one and demonstrate to you how we use it. So the mask that we have in right now is a fabric or cloth mask. It's being made by the institution, but when you come, you need to come with such. So when you put on a mask, ensure that you hold the straps. Or if it's with you hold these straps, the bands, and then you put it on. The mask should be placed by holding the straps and ensure that it covers, it actually loops into your ears. This way. Okay. So when you do this, sometimes the mask might go into your eyes or into your chin. Ensure that you expand it properly to cover the nose using the edge, and then the mouth and the chin. One important thing you need to do before you put this, ensure that your hands are sanitized. So we'll begin the process again. So this is a mask that is, you check for deformities. If it's not torn, mine it's proper, it's already sterilized. So you wash your hands, you sanitize your hands, or you wash your hands using the available sanitizer with the steps that are already in place. And you wash at least for 20 seconds. You sanitize your hands for 20 seconds if your hands are not visibly soiled. If your hands are visibly soiled with dust or anything, then you do hand washing. You only use a sanitizer when your hands are not visibly soiled. My hands are not visibly soiled, so I use a sanitizer. And then I take the mask, check for deformities. It's not torn, it's fit. Then I put it on by holding the straps. And then I loop it over my ears, and then I expand it to the three parts: the nose, the mouth, and then the chin. This is the proper way of putting on a mask. Ensure that you are able to breathe properly. And then removing, you begin from where you began. So when you're removing the mask, you hold the straps again. Don't hold the front area because the virus might have landed here. When you hold the front area by mistake, you do what? You sanitize again. Okay? When you hold the front area by mistake, you sanitize again to ensure that it's safe. And ensure you avoid holding this front part. Don't remove your mask this way. Don't put your mask this way. Don't put your mask, some even remove it this way. Don't do this. This is not appropriate. Ensure that your mask is put on properly. So when removing the mask, ensure you hold the loops. You hold the loops and then you remove it. In case you want to wash, ensure that you have warm to hot water with any detergent. If you're using laundry, you can use laundry detergent. If you're using laundry machine, you can also wash it at that point. But what we say, you can use any normal bar soap to wash these fabric cloth masks that you've been told to come with. So ensure that you place it in preferably hot water, and then you wash it properly. After washing it, you can sun dry it. Don't place it in your hostel where the sun cannot reach, because we know that the UV lights are very important in destroying the virus once you place it in the sun to be sun dried. And then after it's sun dried, that's why you said you come with more than a pair of the mask. You can wear the other one. So these masks, you can wear them until when it's torn, that's when you replace. That's the good thing with the cloth or fabric mask, which is approved by the CDC, WHO, and also the Ministry of Health. You can wear the cloth mask. So that is what you are saying, that for washing. If you want to dispose, ensure that you don't touch it. You want to dispose, place it in a waste disposal paper, or bring it directly to the medical department, medical services department, be able to show you where to dispose your fabric mask in case you feel it's not it's not, it's no longer fit for use. So that is all about cloth masks. Now I'd like to move on to the next part, which is about social and physical distancing. The lecture halls where you will come to attend your lectures when we resume physical in-person learning are already marked. And in the process of marking other halls and other places, maybe student finance and other places in the institution, to ensure that you maintain that physical distancing. And I'd like to insist this to all the students coming in: ensure that once you're out of the lecture halls, maybe you're walking towards your hostel, ensure that you also maintain the social and physical distancing. Avoid close personal contact, because you don't know this person if he's a positive case or not of COVID-19. Okay. So in the lecture halls, we'll ask you to maintain physical distancing. If possible, carry a small sanitizer with you, because you may not wash your hands in the lecture halls. Carry a small sanitizer with you, sanitize frequently, keep yourself safe, put on your mask properly, and so on. Same case to every hall and the hostel. If you're in a hostel, either outside the institution or in the institution, ensure that you maintain physical distancing, put on your face mask properly, sanitize frequently, wash your hands frequently, and so on. If you're sharing your phone, that is about cleaning and disinfecting, ensure you clean it properly. You can use soap and water. For electrical items, don't use a lot of water for those items. You can use a sanitizer with a cleaning material, clean if it's a phone or your computer, clean properly. Don't use water to your computer, I know it will not work after that. So ensure that you disinfect properly with the appropriate disinfectant. Appropriate disinfectant we have at the moment for fumigation is sodium hypochlorite. That one is available. We'll be doing fumigation frequently as you come in. Now, we have something called home-based isolation and care. This is important. So the county government of Kisii has a 300 bed capacity. This might not sustain all of Kisii University students and the entire Kisii community. That's why you say we need to do home-based isolation and care. Once someone tests positive, there is a protocol, but that the medical services department will follow to ensure to actually ask or to gauge if you can do home-based isolation and care. There's a protocol. You cannot be in home-based isolation and care if you're in a hostel. You have to go to isolation at the referral hospital. The medical services department also has a regimen for flu-like symptoms. Anyone who has a flu-like symptom, the clinic officers and the medical officer will put you into that regimen, which is available in our services, medical services pharmacy, which will be given to anyone who experiences flu-like symptoms to cover you from developing COVID-19. Any person with a pre-existing condition, especially the ones that are like asthma, chronic upper respiratory tract infection, uh, like hypertension, cancer, HIV/AIDS, or if you have diabetes, then you're expected to actually be more vigilant, because we've already known that COVID-19 affects people whose immune system is already compromised. So you need to take precaution and don't neglect putting on the mask, the things we've said in the SOP, the hand wash, sanitizing, mask, social distancing, if you have pre-existing condition. Now, we ask you to come to the medical services department to check your diabetes, blood sugars, that is, and hypertension at the medical services. Even for prostate cancer, kindly visit the medical services department for these services. You will find them. We offer these services at the medical department. You can also check your BMI. People with the BMI of more than 25, that is a overweight and obesity towards 30 and above, we ask you to come and check and know if you have a BMI that is putting you at risk of COVID-19. In case of any issue, we are developing a toll-free number which you'll be able to call and it will not cost you anything. Once it's out, Edgar will let you know. And if you have any inquiry, kindly you can write to medical@kisiuniversity.ac.ke. That is the medical services contact number which we use for the facility. And you can also reach out to the Dean of Students in case of any inquiry regarding COVID-19. If you see your friend in the hostel suffering or having a serious cold, congested and running nose, or any of the symptoms we mentioned, and you don't have a contact, you can reach out to Edgar or the Dean, and then they'll be able to let us know. Or in case you don't reach out to us, then you can reach out to those important people. And for counseling and emotional and psychosocial support, kindly reach out to the Dean's office for all your counseling and all emotional support. And none of us should be discriminated, stigmatized, or neglected in one or another because he or she has been exposed to the virus or is a suspected case or is already a confirmed case of COVID-19. COVID-19, if you get COVID-19, it's not a death sentence. There's so many people recover than those who actually get ill of COVID-19 or die of COVID-19. So there are many recoveries than deaths of COVID-19. So that's something we should not worry as long as you adhere to the protocols. And if it gets you by any means, ensure that you follow the Ministry of Health and the guidelines we give you. Take the medication we give you, and the protection measures we give you to protect ourselves and the people around you from COVID-19. So almost coming to the end. These are only charts. Appendix 1, this is the COVID-19 contact register, which I'll be able to show you what is written there. So when you enter any office in main campus, ensure that you write the date you enter in this first column, and then you write your name. If it's Alex Ontiri, write Alex Ontiri. A male, gender, you write there. You write your ID number, registration number if you're a student, ID number if you're a visitor. As staff, you write your PF number. Phone number, indicate your appropriate phone number. Don't write a phone number which doesn't exist, so that you can be able to protect and do proper surveillance. So you also write your address. Where do you come from? The county you are in right now and the possible landmark. If you come from near Kisii School, write Kisii School. You come from near Kisii University, write Kisii University. And so on. Residence, where do you stay? I stay in Milimani, I stay in Membe, I stay in Meyinkwa, I stay in, a hostel. Then you write your hostel there. Why did you, with the purpose of visiting that particular office, say, inquiry for, a change of whatever you want. Maybe it's official, maybe it's, you write the purpose of the visit, the time you check in, the time you check out. Were you screened your temperature? Everybody must indicate the temperature they were screened at this particular point, and in brackets you write the particular temperature you were screened, either 35.8 or 36.1 and so forth, and then you sign. So this, everyone should do this so that you can track objectively. All right. So Appendix 2 is a step-by-step hand washing procedure, which may not be clear this time, but it shows how we need to wash our hands step by step. I don't know, Edgar, if you can do this practically, but maybe later on when you finish. And then how to sanitize is next. So these are step by step. You can follow them. Many people don't know this, but if you follow this step by step, you're assured of your hands being safe and clean and free from the virus. And then your mask, we've already produced these IEC materials and posters on how to put on your mask properly. This here shows how to put on your mask properly, which I've already shown you. And once you remove your mask, ensure you wash your hands or sanitize before doing anything else. And how to wash your fabric cloth mask, we've already shown you. Ensure you remove it from the straps, place it in any bag, a carrier bag, or place it, if you have already warm water, you can place it there. And then wash using normal detergent or laundry or bar soap, and then you can sun dry it. You can either iron it and then put it on, then you're good to go after it's dry. Or if you don't want to wash it after a given period of time, you want to dispose it at the designated point. At the moment, it's medical services department, which is close to the main gate as you get into the institution. So that is the end of COVID-19 sensitization. And I don't know, Edgar, if you can use this time to demonstrate maybe hand washing and sanitizing before questions.
Yes, Doc, that is in order. I think you can quickly do that, and then we can go into Q&A, and then we close the session.
Okay, sawa. Thank you, Edgar. So this is the final demonstration I'm going to do. So as you watch me, kindly follow these steps, and we'll start with hand washing, and then you go to sanitizing. They're basically the same apart from a few components which are not similar. So we said the distinction between hand washing and hand sanitizing is visibly soiled hands. So if your hands are visibly soiled, then you don't use a hand sanitizer, you use a hand wash. If your hands are not visibly soiled, as in uchafu, then you use a hand sanitizer. They work effectively to kill the virus. That's very important for us to note. So I'll start with hand washing. But for this moment, only have a hand sanitizer with me. Allow me to do hand sanitizing. So my hands are not visibly soiled. However, it doesn't say when your hands are not visibly soiled, you cannot use a hand wash. You can use a hand wash either way. So the only time you use a hand sanitizer is when your hands are not visibly soiled. You cannot see any dirt in your hands. That's when you use a hand sanitizer. If you're coming from a farm, you're doing some agriculture education and extension on that course, and you're from practicals or from the practical in maybe health sciences in the medical school, then it's important that you do hand washing. So these are step-by-step procedure on hand sanitizing. You apply, I'll do this, and if possible, someone has a hand sanitizer in the, in the participants list, then we can be able to do a step-by-step. Kindly follow me. Number one, you put enough hand sanitizer into your hands, enough. And this process takes about between 20, at least 20 seconds for hand sanitizing. And then you apply it to cover your surface, and if possible, the outer part of the surface. And then you put the right hand on top of the left one, or whichever way you start. You can put the right on top of the left, and then you interlock the fingers. And then you actually do the scrubbing. Okay, and then you change the hands. Now the left on top of the right, or whichever way, the opposite of what you started, and do the same, interlock the fingers and ensure that the fingers, in the middle of the fingers, is properly cleaned. After doing that, then you come to the inner part of the hands. Ensure now you interlock the fingers this way. Okay, so interlock the fingers and ensure you scrub properly, and ensure you scrub in a way that you'll actually feel that your hands are being sanitized properly. After doing that, you've left the tips of the fingers. So you interlock again the fingers and rub to ensure that the fingers and the nails are properly cleaned. So you do this and change again to the other hand. After doing that, there's a finger you've left. And I don't know, Edgar, let's get someone saying that finger, you've left the thumb. So the thumb is what you've left. Ensure that you sanitize properly. You sanitize the thumb properly. After doing that, you can also move to the wrist, because sometimes you might handle something up to the wrist. So you sanitize to the wrist. After doing that, the tips of the fingers are what you've left. So at the middle of the hand, then you can do the cleaning of the tips of the fingers. The nails, at the middle of the hand, you can do the nails. After doing that, I believe 20 seconds should be done. I've done it slowly so that you can understand. So I like to start again, and if you have a hand sanitizer with you, you can try and do that. So step number one, put enough hand sanitizer, which you're producing in the institution. It will be available for all the students, and even hand wash. You place the hand sanitizer in your hands in sufficient. Apply it evenly to both parts of the hands. And then after doing that, you bring the one hand on top of the other so that between the fingers are interlocked, and you actually scrub properly. Change the hands again, scrub properly. Come into the inner part of the hands, you scrub properly. And then after doing that, you come to the fingers themselves. So you interlock the fingers again and scrub properly. Change the fingers again, scrub properly. After doing that, there's a finger you've left called the thumb. Ensure that you actually scrub it properly, and then change again, scrub the other hand which you had left properly. And then the wrists, you can do the wrists. After doing the wrist, you come to the tip of the nails. The nails themselves, you place them at the middle of the hand and do proper cleaning. Use the hand sanitizer. By the time you're done, your hands are clean and safe for you to either put on a mask, remove a mask, touch a phone. After touching a phone, you do the same. Now, we can sing Happy Birthday. By the time you're done in Happy Birthday, the song Happy Birthday will be able to be done, or you can sing the first stanza of the national anthem. And then by that time, you'll be able to be done with hand sanitizing. For hand washing, the same procedure. You put water first, and then you put soap. You follow the entire procedure, and then you wash your hands under running water. So that's what we've already said. And then if you don't have a serviette, you can use, you can leave them to dry, or you can use a dryer. So don't share a piece of cloth when you're cleaning your hands after using a hand wash. So these are some of the practicals which I believe once you come in again, you'll keep on insisting so that you can be able to protect yourself from the virus. And I believe you're keeping safe wherever you are, and we look forward to seeing you with all those put in place. So back to you, Edgar. I believe that is all from the medical services department in terms of COVID-19 prevention. And your role is to actually do whatever we've been informed. Thank you so much, Edgar.
Thank you, Dr. for the assist in the presentation and for guiding our students to be ready for us to embrace them in the coming days as they're going to come in. Thank you for being with us, our dear students, this morning. Those of us who are following on YouTube, those of us who are watching here from the Zoom, we appreciate you being with us, and I hope you have learned. This recording is going to be available on all those two platforms, and I would recommend that this is not the end of the conversation that you just had with Daktari, that you go through the video again and see if there's anything you have missed from his conversation and from what he has just explained to all of you. So that by the time you come to the university, there are quite a number of things that you'll notice. For those of you who are coming in for the first time, I guess this will be your normal for now. For those of you who are coming back from when they broke schools in April, in March, I guess you'll notice the difference when you come in from the way we even interact with you and from the way we even guide you in different matters. We are avoiding face-to-face interaction as much as we can, trying to solve matters on digital platforms. Even the studies that you're supposed to retain and continue the exams, all of them are mostly being done online so that we try and keep you in your houses, in your rooms, and give you the education that you need. And you come to the university only when you actually absolutely have to come to the university. So you will notice all these, and that means that you have to also take the same measures into account as you are doing your own things. Don't keep walking around if you don't have to. Just leave your house when you have to. Just interact with your lecturers physically when you have to. You can reach them on the phone. You can reach them. They'll be closer to you, but you can reach them on the phone on digital platforms, and you can share with them even beforehand. There are quite a number of questions, I know, not only for from the medical perspective, but on logistics. But just to completely clear this first before I give an option for, I need to give an option for Daktari. For those who want to ask medical questions, you can raise your hand in Zoom and I will unmute you and give you an opportunity to ask Daktari questions. But for those of you who are looking for logistical questions, I'll quickly give this brief. You've seen the calendar that is already out there circulating. It's also going to be shared with some media platforms, external and internal, so that you know how you're going to reach. I think the first group that is coming to the university will be coming to the university as from 8th, which I want to believe these are the 4.1 students who are supposed to go to attachment last year, or not last year, but last semester, but did not. And then once they're coming right now, they're coming to report and begin a new semester and do exams. Then after those exams, they will continue with studying towards finishing for attachment across the board. I think the other group of students that are going to join us this semester on 13th, I believe, are the first years who I think some of them are within us right here and others are watching through YouTube. And first years, you'll be coming in for the first time to the university. So we are going to take a special preference to look at what you need and what you are required to do so that you understand, because you have two, for you have two principles. One, it's you need to come into the university and maintain social distance and keep safe. And two, you also need to know the university. We did online orientation the other day, but it's nothing compared to the physical program that you're supposed to handle when you're here. So we are going to find a way to make sure that you are physically oriented into the system, not go through the whole program that we did go through earlier, but just show you where you need to go and the things you need to do, etc. But more than often than not, for you, most of your programs are still going to be online. Even though you're going to be physical, you're going still to conduct most programs online, but we are going to give you special preference because we understand you don't know Kisii University yet, and you need to understand Kisii University. You have issues with accommodation. You want to know whether you're going to be able to learn and study and be able to, know where to sleep, accommodation wise, whether you're going to get an access in the university hostels, whether it's the outside hostels. There are so many questions that we know you have, and we are aware, and we are working closely to try and coordinate all these things so that we give you elaborate communication on exactly what you need. Some of you are asking, do I carry all my luggage from home and come? All those things are coming in the course of the week, so just be patient. You will be guided enough. I think we've been with you long enough since June, and you've been able to understand that after every process or before every process, we give you complete communication on what is going to happen. For the continuing students, I don't have to worry a lot about that because you know your way around the university already. You know where you're staying. It's only you need to enforce what Daktari has ensured that you understand this morning on the COVID-19 protocols that the university has, and be able to notify us. You have all our contacts. Be able to notify us as quickly as possible in case a suspected case comes across where you are, whether it is your house, whether it is your class, whether it is the laboratory, be able to notify as quickly as you can. As we continue with this program and the way we are running things, at the moment you realize that things are really differently, but we're able to go that. So I want to wrap it up at that particular point for now, and let you know that don't worry. For those of you with many questions, we are working very hard to make sure that all those questions are resolved and that you have proper communication and proper briefing before you are able to come to Kisii University and be able to be with us in the things that you're going to do. So for now, I'm going to just switch quickly into the chat, into the participants list, so that I see if there is anybody raising their hand and I give them an opportunity to ask Daktari the question, and then Daktari can respond. I want to assume the people who are raising their hands right now are the ones who want to ask medical related questions. So I'm going to start with Musesi Joseph, and as I unmute you, please go ahead and unmute yourself, Musesi Joseph.